The U.S. exit from the WHO and the freeze announced on USAID funding are devastating moves that will have drastic effects on the health of millions of people in Africa. Let's unpack this further now. The PEPFAR fund freeze impact globally, regionally and for South Africa. Let's speak to UNAIDS Executive Director, Winnie Byanyima. Good evening to you. Thank you so much for your time. I mean, there's panic, right? Especially when you speak to a number of NGOs in this country. They talk about how this announcement may have devastating impact. I wonder, how are you processing all of these developments?
Yes, the announcement by the United States government to freeze funding foreign assistance, both to PEPFAR and broadly, has been shocking because of its immediacy and because of the important role the United States plays for us in the HIV response. Globally, the United States shoulders about 73% of the total cost of the HIV response that is supported externally. So they're the major external donor. Here in Africa, many countries where the AIDS pandemic is concentrated are dependent on US assistance by more than 50%, some up to 90%. Countries like Tanzania, it's more than 90%. Countries like Uganda, more than 70%. Rwanda, more than 50%. South Africa is not so dependent. It gets about 17% of its response paid for by some support from the American government. But the immediacy of this all means that countries do not have the time to move quickly to fill an important gap. That's the biggest challenge. The second big challenge...
Yeah, pardon me, go ahead.
The second big challenge is that the people who are affected, who live with HIV, who are mostly supported by this funding, are people who are discriminated, people who face harsh criminal laws, people who need privacy in order for them to be on life-saving treatment. And we have an army of people all over the continent who have learned over years how to serve such vulnerable populations. Right now, so many of them are out of work because their contracts were paid for by the US government.
Yeah.
So the most impacted are the most vulnerable.
And one wonders then, what does it mean, especially when you look at the fact that over time infections have been falling, right? And now, how much of a setback is this likely to be?
Huge. Indeed, for a country like South Africa that stepped in rather late to fight the HIV/AIDS pandemic, it was so ambitious, and most countries in this region have been making the fastest progress in reducing new infections and reducing deaths. But today, this sudden pause of solidarity from the United States means that while we had 630,000 AIDS-related deaths globally last year, if the assistance of the United States is not replaced by other donors or the governments of Africa themselves filling the gap, which they can't, we will have an additional 6.3 million deaths in the next 5 years. That's triple. That's multiplying by 10. We would have 8.7 million more additional new infections. We would have 3.4 million more AIDS orphans. So you're talking of a huge surge if this gap is not filled. But the good news we have heard, first there was a waiver. A week after the freeze of all assistance, there was a waiver for this aid to HIV, to PEPFAR, to humanitarian causes to be renewed, to continue. But there's still a review. In 90 days, we will know whether it continues or it doesn't. We also heard Secretary Rubio a few days ago say that he does believe in the role of PEPFAR, the American program, and that he would want to continue supporting it in a different form. We welcome that. We thank them for realizing that life-saving support to Africa and to other countries is an important part of the relationship between us, ourselves, our region, and the United States. But we are still in confusion in many countries about what's being paid for and what's not being paid for. Many clinics are still closed. Drop-in centers for people at risk are closed. So the challenges are huge on the ground right now.
And it comes at a time, right, when there was a lot of conversation about the groundbreaking lenacapavir, for example, a twice-yearly shot that was seen as a breakthrough. And a lot of people now watching that conversation as well, wondering what does it mean for them?
Bongiwe, you're so right. Because the people at risk, sadly, on this continent are mostly adolescent girls and young women. And there is on the horizon a prevention tool that was tested in South Africa, in my country, Uganda, and is 100% efficient and injectable twice yearly that removes the risk 100%. And that was being prepared to be rolled out. By the way, the profits would go to an American company, Gilead. Let's be clear, this aid does benefit also the giver. It's not completely charity. It saves lives, yes, for poor countries that couldn't afford, but it delivers profits and jobs for American companies and American workers. Now, that is now stopped. These trials that are largely supported by PEPFAR funding, so the American companies get subsidized through aid to do their research. We support them through our own institutions. This work, not only on lenacapavir, but on other new commodities, is halted now. So we need to see it as an ecosystem. We need the American government to do the math carefully and see that there are benefits for their companies, for their people, and they save lives in other countries that are lacking the means, that are grappling to raise their domestic resources, and that there's a global benefit here. So yeah, you're right, Bongi, with that prevention. We were about to reach a revolution where we could reduce new infections down to zero, and that would really be close to ending this disease. So the American leadership is so important here to end this disease, HIV/AIDS.
So should it happen, right, that come the expiry of this 90-day period and things don't go the way of the many countries that are actually relying on this and now finding themselves having to make do with whatever possibly little or nothing that they may then be given, do you see any donors stepping in to fill the void?
I do not see the possibility of filling this void completely by other donors. That is why I'm going to the African Union tomorrow to give a message to the heads of state that they need to come together because each has different capacity. As I've said, South Africa is not so dependent. Tanzania is very heavily dependent and everything in between. They need to come together, first of all, to speak together to the American government to work together for an orderly transition where they work rapidly towards paying for their own responses. That is important. That means also that some things must change, like increasing domestic resource mobilization. That means working on some reform of the financial systems, the tax systems, so that they can raise more money and not let profits go out untaxed. That means the debt, which is choking many countries, which is taking 4, 5, 6, 7 times more debt repayments than health, that debt is restructured and they have space to pay for health, for HIV. Certain things must move fast, both in the global space, but also in Africa. And African countries must negotiate with the American government and also reprioritize their own spending. I mean, when lives are at stake, there are certain expenditures you must stop in order to keep your people alive.
Yeah.
So there are some immediate actions that African governments must take. This aid may come back to a certain extent, but not fully. So they need to be ready to fill the gap themselves. Our leaders must grapple with that.
If President Trump were watching right now, what would you say to him?
I would say to President Trump that global problems need global solutions. Pandemics respect no borders, don't ask for visas. You need to be part of global solutions to global problems such as such a pandemic. That requires solidarity, supporting those who don't have means to fight with you to end an epidemic such as HIV/AIDS. I would say to him, thank you, because in your first administration, you stepped up, supported PEPFAR, supported Global Fund, supported UNAIDS, the global institutions that support the fight against AIDS. You supported HIV. Now, continue from where you started. Continue being a leader on global health, because global health is global security. I would say to him also that while you're doing this, there are benefits, because innovation, science for solving these global health problems is led by your companies, is led by institutions, gives good jobs to American people. There are benefits. It's mutually beneficial. Stay on course, not just for HIV, but in the whole global health space. But I would also say to him, yeah, call on other donors to also increase their contributions. It can't be right that one country shoulders 73% of the total HIV external support. It can't be right. We would need more countries with means to step into. Those are the things I tell him about HIV.
And I certainly hope you and I speak again, especially after you finish your meeting with the AU leaders, just to get a sense from them as to how then do they plan to respond should the the funds not come in the manner that they would have come before, and the aid when it comes to a lot of work that has been done on the ground, what happens next. But appreciate your time, Winnie. Hope we'll speak again just after that meeting. That's the UNAIDS Executive Director, Winnie Byanyima.